to Masshealth patients for dental care, we're essentially driving them to the emergency rooms. The emergency rooms are very, very expensive. They are. We taxpayers end up fitting the bill.
Yes, I know.
It's not free. Our communities pay for it. We pay for it. This is not an efficient and an effective way of trying to minimize our healthcare budget. By cutting dental care, we are only increasing our commitment in terms of a budget that's gone out of control.
So what have you done? I mean, is Governor Patrick aware that there's a group that what can the representatives do? When will this bill come up? When will they vote on it? How much time do you have?
I don't think we have much time. I think if we are to act, we need to act now. We can't wait to the last minute. We need to let our representative and our legislature know that it is important that we act now, that this is a cause, this is something that's important to us, and ever more so important right now during these economic situations that our communities are facing.
What about somebody like Tim Cahill? Now, he's running for governor.
Yes.
And he's in Quincy, is he not?
Yes, he is.
Is he an advocate? Can you get him on board?
I've written to Mr. Cahill, and he's given me very positive response in terms of his policies are not ones that involve cutting health care. He's not interested in making cuts, at least to health care. Yeah. I think there's nothing more important to you, me, our families and friends than health care. That should be our priority. I think we should support our representatives, support those who support us.
Do you know who's supporting you? Who people should write to or call? Because that's what helps. Does it help to call the governor's office? It's an election year.
I think it would certainly help us to let him be aware that this is an important issue to us. If he wants to represent us, he wants to represent our community, our families, then he needs to truly understand the meaning of representing us. And he needs to give us assurances that he's going to protect our health more than anything else.
What about Charlie Park? Is it Charlie, the other one who used to be Harvard Pilgrim and is running for governor? There's another one. And what about Christy Myhouse? He's running for governor. These are people that might, or is it the ones that are in office now and are going to vote on this bill that will be the thing?
I don't think that we should, as a community, we should focus on any one particular candidate.
Okay.
I think we should inform all the candidates and all those who are representing us currently that this is an important issue. And if you can't do the least for us in representing our health, in protecting our health, then what are you representing?
Where is this right now? Is it on the governor's desk? Does he have to send it to the legislature for a signature? How does this work?
He has proposed it in his fiscal year budget for 11, okay? And it has to be voted on. So we have an opportunity to change this.
Okay.
There was a period of time where they had canceled Masshealth for a couple of years in the past. And the results are detrimental. We are still paying for those years of failed health policy. Things that in economic terms could have been treated for a very small sum of money have surmounted to become thousands and thousands and thousands of dollars that we are now paying for the mistakes that we had made in the past. We can't afford to make these mistakes again. And we need to fight, and we need to fight for our fundamental right, which is health. There is no other right more fundamental than health. And we need to do something.
Do you have a lot of other physicians and dentists on board?
I have a lot of dentists on board.
Okay.
My physician colleagues that I've known through my training are all on board. They understand that when you're a general practitioner, physician, or dentist, your treatment and your care for your patient is not limited to one anatomical region. Your hand is connected to the rest of your body. Your mouth is connected to the rest of your body. If you neglect any part of the human anatomy, you're asking for a systemic issue. Our physician colleagues are very, very much aware of this. Our dental colleagues, you know, we're very, very much aware of this. We see systemic diseases, HIV, we see signs of hematological diseases. We see a lot of these things in the oral cavity first.
That's what they say.
They do, and very often we are the ones that diagnose these diseases and refer patients to their primary care physicians. We are one of the most fundamental first line of defense. A lot of people see their dentist a lot more often than they see their primary care physicians.
Yes, that's true.
Every week we've referred patients to their primary care physicians for hypertension that they're not aware of.
Is that right?
Yes, and we see, we send patients over for that we see signs and symptoms of other systemic disease like bleeding issues, diabetes. We see a lot of this in the oral cavity. We are the front line. We sit there and we're the guardians of our community's health. And I can't imagine what it would be if people just can't get their routine care access.
Do you have a good feeling that this will not go through? How do you feel? Are you worried?
I'm very, very worried. I'm very, very worried because I've developed relationships with almost 400 to 500 patients. These patients, they're my family, they're my friends. They're people I see every day when I come out of work. They're people who serve me in the restaurants. It's hard for you to disassociate yourself from your community and your friends. It's hard for you to tell these people who count on you, who trust you, to tell them, you know what, you can no longer get care from me. It's not easy doing that. Doctors are people. We are members of the community. We care about our community genuinely, and to see this is horrible.
And you said to me on the telephone, Phyllis, I have a nice practice. I'm not going to be affected. I am doing this because I care. Yes. And what can we do other than do things like this? Is it better to call or write representatives? What is it better to do? Do both?
I think it's best if we do both. We have to do both. We have to do both. We need to call